Our NHS hospitals, a shocking truth. We all rely on the NHS. It's a cornerstone of our society, a beacon of hope and care. It's there for us in our hour of need, from our first breath to our last. It cradles us in our most vulnerable moments. We trust it with our lives and the lives of our loved ones. It's a trust built over decades of dedicated service and care. But what happens when this cherished institution is plagued by a hidden enemy? An enemy that threatens the very heart of its care. An enemy that lurks in the shadows, undermining the very foundation of our trust. The shocking truth is that many of our NHS hospitals are battling an insidious faux filth. This is not just a minor inconvenience, it's a serious threat to health and safety. Recent reports and surveys have exposed a grim reality of vermin infestations, poor hygiene, and crumbling infrastructure, painting a worrying picture of the state of our hospitals. These issues are not isolated incidents but widespread problems that demand immediate attention. This isn't just about aesthetics, it's about basic safety and the ability of the NHS to provide the high-quality care it's known for. Cleanliness and proper maintenance are fundamental to patient care and recovery. The NHS is facing unprecedented challenges, but allowing our hospitals to fall into disrepair is not an option. We must address these issues head-on to ensure the safety and well-being of all who depend on the NHS. It's time to face these uncomfortable truths and demand better for our NHS, for the patients who depend on it, and for the dedicated staff who work tirelessly within its walls. Together, we can push for the changes needed to restore our hospitals to their rightful state of excellence. The NHS England report, released earlier this year, sent shockwaves through the nation, raising serious concerns about the state of our healthcare system. It revealed a stark postcode lottery when it came to hospital cleanliness, showing a significant disparity in hygiene standards across different regions. Some hospitals were struggling to maintain even basic hygiene standards, with dirty corridors, unclean beds, and untidy patient rooms becoming alarmingly common. The report highlighted a worrying number of hospitals failing to meet the minimum standards for cleanliness, which is essential for patient safety and recovery. Some hospitals were even deemed high risk due to the presence of vermin, poor waste disposal, and inadequate cleaning practices, posing a serious threat to public health. These findings were not isolated incidents. They pointed to a systemic problem within the NHS, indicating a widespread issue that required immediate attention and action. This problem couldn't be ignored any longer, as it directly impacted the quality of care patients received and the overall trust in the healthcare system. The report didn't shy away from naming and shaming the worst offenders, bringing to light the hospitals that were failing their patients the most. Hospitals like Name of Hospital and Name of Hospital were singled out for their appalling conditions, with inspectors finding numerous violations that compromised patient safety. Inspectors reported sightings of rats, cockroaches, and overflowing bins, painting a grim picture of the state of these facilities. These hospitals, entrusted with the well-being of thousands, were failing in their most basic duty, to provide a clean and safe environment for healing, highlighting the urgent need for reform and accountability within the NHS. One of the most disturbing revelations from the NHS England report was the alarming rate of vermin infestations in hospitals. Rats, cockroaches, and silverfish were found to be commonplace in many hospitals, lurking in corridors, wards, and even operating theaters. These creatures aren't just unpleasant to look at, they pose a serious health risk to patients, staff, and visitors alike. Rats and cockroaches are known carriers of diseases such as Salmonella, E. coli, and hantavirus, all of which can have serious, even fatal consequences, especially for patients with weakened immune systems. The presence of vermin in hospitals is a clear indication of deeper hygiene issues. It suggests inadequate waste disposal, poor building maintenance, and a lack of effective pest control measures. These infestations are not just a nuisance, they are a breeding ground for infection, and a stark reminder of the urgent need for improved hygiene standards in our hospitals. The consequences of poor hygiene in hospitals go far beyond mere discomfort. They pose a direct threat to patient and staff safety. Hospital-acquired infections, or HAIs, are a major concern, and the presence of vermin, dirt, and grime only exacerbates the risk. Patients already vulnerable due to their illnesses are at an increased risk of contracting infections like MRSA, C. difficile, and pneumonia in an unclean environment. These infections can lead to prolonged hospital stays, complications, and even death, adding further strain on an already overburdened NHS. But it's not just patients who suffer the consequences of poor hygiene. NHS staff are also at risk. Nurses, doctors, and cleaners are constantly exposed to potential pathogens, and inadequate hygiene practices increase their likelihood of contracting and spreading infections. This puts a further strain on the NHS workforce, leading to staff shortages and impacting the quality of care provided to patients. Section 5. Voices from the frontline NHS staff speak out. The findings of the NHS England report were echoed by a recent survey conducted by Unison, the UK's largest trade union for health workers. The survey, which polled thousands of NHS staff, revealed a deeply concerning picture of the state of our hospitals. Over 70% of respondents expressed concerns about hygiene standards in their workplace, with many reporting that they felt unable to provide the level of care they aspired to due to the poor conditions. One nurse who wished to remain anonymous shared her experience. "It's heartbreaking. We're doing our best for our patients, but it's an uphill battle when you're fighting against dirt and grime. I've seen cockroaches in the ward, rats in the corridors, and the smell from the overflowing bins is enough to make you sick. It's simply not acceptable in a place where people are supposed to be healing." Section 6. A Tale of Two Hospitals, the Clean and the Dirty. The NHS England report didn't just highlight the bad, it also shone a light on the good. While some hospitals languished in a state of neglect, others stood out as beacons of cleanliness and hygiene. Hospitals like Name of Hospital and Name of Hospital were praised for their spotless facilities, rigorous cleaning protocols, and proactive approach to infection control. These hospitals demonstrated that maintaining high standards of hygiene within the NHS is not an impossible dream, but an achievable goal. The stark contrast between the best and worst performing hospitals highlighted the crucial role of leadership, investment, and a culture of hygiene in maintaining clean and safe healthcare environments. It proved that where there's a will, there's a way, and that every patient, regardless of where they are treated, deserves to receive care in a clean and dignified setting. Section 7. The Price of Neglect: Long-Term Consequences. Ignoring the issue of hygiene in our hospitals is not an option. The consequences of neglect are far-reaching and will have a lasting impact on the NHS and the nation's health. Allowing hospitals to deteriorate sends a dangerous message that we don't value the well-being of patients or the hard work of NHS staff. It creates a vicious cycle of decline, where poor morale leads to lower standards, which in turn leads to further neglect. Moreover, the financial cost of poor hygiene is significant. Treating HAIs places a huge burden on the NHS, diverting resources away from other essential services. Investing in preventative measures, such as rigorous cleaning, effective pest control, and regular maintenance, is not just the right thing to do. It's the financially prudent approach in the long run. Section 8. Time for action: investing in our NHS. Our healthcare system is the backbone of our society, and it is high time we take decisive steps to strengthen it. The time for excuses is over. We must act now to address the pressing issues that our NHS faces. The NHS is facing a hygiene crisis, and it's time for action. Cleanliness is not just about appearance. It is a fundamental aspect of patient care and safety. The government must prioritize investment in our hospitals, ensuring that they have the resources they need to provide clean and safe environments for patients and staff. This includes not only financial support, but also strategic planning and oversight. This means investing in increased cleaning staff. More hands on deck will ensure that every corner of our hospitals is kept spotless. Hospitals need adequate numbers of trained cleaning staff to maintain high standards of hygiene. Improved cleaning protocols are essential to meet the demands of modern healthcare. Implementing evidence-based cleaning protocols and ensuring that staff are properly trained in their use is crucial. Effective pest control measures must also be a priority. Regular pest control measures are essential to prevent and control vermin infestations. Building maintenance and renovation are equally important. Addressing issues like leaking pipes, dampness, and peeling paint will help to create a less hospitable environment for pests and reduce the risk of infections. These improvements will also enhance the overall patient experience. Investing in our hospitals is not just about bricks and mortar, it's about investing in the health and well-being of our nation. A clean, well-maintained hospital is a place where patients can heal and staff can work effectively. It's about restoring pride in our NHS and ensuring that it can continue to provide the world-class care it's renowned for. Together, we can build a healthier future for everyone. Section 9. A clean hospital, a right, not a privilege. Access to a clean and safe hospital is not a privilege. It's a fundamental right. Every patient deserves to receive care in an environment that promotes healing, not one that puts their health at risk. It's time for the government, NHS leaders, and all of us to demand better. We must hold those in power accountable for the state of our hospitals and work together to ensure that the NHS has the resources it needs to provide the high-quality care we all deserve. Let's not allow the NHS to crumble around us. Let's fight for a cleaner, safer, and healthier future.